through email. We don't have any of those kind of gizmos, and the best way to reach them is either through direct mail or through TV advertising. And I'd like to, and I want to make sure that we don't miss that group of people, which is a large percentage, that are really in the dark, and only information they get is what's on channel 30, what's that, the Bear Dallas news station. And so I'd like to see us do something to reach that group of population.
Right, so I think one of the things that folks actually respond to direct mail. So how do we take our relational model of organizing by neighborhood, by community, and extend it to those people? For example, when I was down in Danville for our last listening tour event the other day, folks said, well, word flows in Danville by text message, and that we need to tie people into a text message network. When I was in rural Pennsylvania, there was no cell phone coverage. That's where I was in the primary, right? So text message wasn't going to get you too far in the middle of rural Pennsylvania. So folks had to go through personal networks there, and they had certain places where they gathered in some smaller communities. So one of our challenges is going to be how do we customize in the different parts of Virginia, right?
I think we should be multifaceted. I don't think we should be limited to one form of communication. I mean, you get all of them. 2% is better than nothing. You
Right.
get 2% from that group, and then whatever the percentage are from all the other media forms of communication. It needs to be, all the way around. Don't limit ourselves.
Yeah, absolutely. Okay. Goals in Virginia, a state that hadn't been blue since the 60s, right? But it was going to turn blue and elect a man named Barack Hussein Obama in 2008, right? Who would have told you that with 10,000 extra Republican voters that was going to happen in Virginia? No expert would have said that, but you guys went out there and registered 500,000 new voters. You changed the map, not only in counties all across Virginia, but volunteers just like you all across the country. And it's the same with organizing around issues. We don't need to compete with other organizations for volunteers. We need to figure out how to aggregate our power with other organizations and how to organize really broadly and think outside the box about who our friends are, right? That they're not just the usual suspects, they're not just Democrats. They are, but they're also other people too who care about these issues. Maybe the Small Business Association, just really getting out of the box and thinking about that. And we can coordinate and organize with other organizations. And that helps make us more sustainable if we take our infrastructure and the infrastructure of other organizations and kind of figure out how we can work together to carry the load. I saw a hand over here, yes sir.
Yes, doesn't it?
This right away, that folks are unclear on what the policy is. You want talking points, you want better definition of what we're organizing around, and I want to let you know that we do have resources for you on that, and anybody who signed up today with their email, we'll push those resources out to you. There will be more stuff coming up on the web. We have heard this request loud and clear in our listening tour, and we have talking points geared towards small business. Just like during the campaign, we have talking points geared towards sort of the different questions that go around healthcare. But another question that I heard come up, in fact sheets, but another question that I heard come up was how can we capitalize on the lessons learned from what happened during the Clinton era, right? And the whole structure of our campaign is basically designed to, and I shouldn't even say our campaign because it's the effect in the 90s, Hillary Clinton sort of, took this bill that was all written and detailed and sealed up in a nice little bow and walked it up to Capitol Hill and said, please pass this. And Congress was not particularly interested in passing something that had just been handed to them and they had no say in writing. And then even if you look at the flip side of that coin, in 2005, President Bush tried the same thing with Social Security. Put together a whole package, marched it up to the Hill, here, pass this, and that didn't work either because that's not how Congress behaves. And we have been stuck now for 60 years on this health care issue. So what President Obama has done is try to engage Congress in this and to put forward principles that whatever they come up with must comport with, but not to try to go the same route that has failed time and time again.
Nonsense to get Medicare through and grabbing them by the collar, getting them in their face and getting them in the White House and really doing a leadership thing. And I'm beginning to suspect
People together is great, but you've also got to fight the companies so that the politicians are stuck in the middle. They want your votes, but they also want the money from sums, hundreds of thousands every year, individually.
So, but what does that
campaign
money
contributions. So
intended to do?
which way are they going to turn?
Right, but what is that money intended to do?
Influence their vote.
Building those to a critical number depends on quality of the organizing. Here, you know, if you all sort of leave and don't take any declarations and don't ever do anything about this again, they certainly aren't gonna magically multiply, right? So this is about a genuine communication between constituents and their elected officials. And this is about the relationships that you build in your community, that we're here to facilitate, but that you should have ownership over. Does that make sense?
Herbert Towns. I'm the chair of the Hopewell Prince George Volunteer Organization in Hopewell, Virginia. And, you know, our group is a grassroots organization who's backed by Organizing for America. We are the people that work for the campaign, and now we're an issue-driven group. Right now we're working on our health care reform. And we're working on the principles that President Obama has put out for Congress and the Senate to work on to guarantee health care for everyone. And we meet every third Monday of the month right here at Hopewell Library at 7 p.m. And I'd like to see you there. Thank you.